Welcome to Electronic Nursing Notes, a guided video by Amy Joyner, RN. The learning goals for this video are: what is electronic charting and why is it important to get it right? Signing in, moving through the nursing note, signing out, ending your shift, and troubleshooting. What is electronic charting and why is it important? Pause the video to reflect on the reason and benefits to electronic charting. Reasons. One of the biggest technological changes that's arisen in the field of nursing is electronic charting. Instead of filling out charts with pen and paper, many nurses are now required to review information and fill out charts online. It serves as the evidence of continuity of care, to standardize documentation, prevent errors, promote clear charting, and a way to store medical records long-term while having an easy way to retrieve them. The benefits to electronic charting are: it provides accurate, up-to-date, and complete information about your patients. It helps promote legible, complete documentation. It reduces costs through decreased paperwork and improved safety. And it enhances privacy and security of patient data. Let's get started and sign in to your electronic nursing note. When you first open the Chromebook, you will come to a section that says Patient Portal and Caregiver. You are the caregiver, and you will click on the Caregiver portal on the right-hand side. Next, you will be asked for a password. This is a password that is specific to your patient, as this Chromebook is specific to your patient. The password for your patient is 00 plus the last four of their medical record number. Not their PDN number, but their medical record number. Next, you will see two icons at the bottom of your screen. You will click on the icon that is a circle and blue and white. That will bring you to your Maxim Healthcare Services Maxim Care Skilled Individual Nurse Sign-In. This is the same sign-in that you use on the mobile app. Once signed in, it'll bring you to this nurse icon. Once you click on the nurse icon, you are ready to start your nursing visit. Pause the video and contemplate the following. If you can't sign in or are having trouble signing in, what are your next steps? Troubleshooting signing in. If your Chromebook is not working at all, make sure it's plugged in. It's best practice to keep it plugged in and save battery power at all times when you're in the patient's home. Do you have the correct Chromebook password? Remember, this is specific to your patient. The password is 00 plus the last four digits of the patient's medical record number. Are you using your correct password? Use the same password you use for the mobile app. When all else fails, call your home office. Woodbridge is 703-490-0796. Nova is 703-533-3131. Moving through the nursing note electronically. After clicking on the visit, the nurse icon, the day's schedule will appear. Click your shift to begin. If your shift does not appear, click Unscheduled Visit and let the office know. Once you've clicked on your visit, click Start Visit. You will now be clocked in. You can adjust and correct the start time for your shift by clicking on the pencil icon. When you're ready to begin, click on Initial Assessment. Moving through the electronic nursing note. Sections of the note. Body systems. Click on the body system that you wish to assess and completely fill it out. If you are missing information, there will be a prompt that will alert you to fix it prior to moving on. Save your work before moving to another section. Once you have completed a section, if you wish to add additional information, you click Add Entry, and you are able to then enter new information. Each section has a comment section that's available to free write any pertinent information. Pause the video to think about the following. If you are busy with a patient and clock in late, how can you guarantee you'll be compensated for the correct time in? Editing the start time. Click the pencil icon next to the start time. This is the page with the clock. To change the time, you can move the hands of the clock or click the keyboard icon on the bottom left to manually enter the time on your keyboard. You must always enter the reason you are changing the time, such as unable to clock in, and click Save. Your correct time will be saved. Don't worry, you will always be paid for time worked. Once you're done charting and ready to clock out, click the back arrow, the top left of the screen, to navigate to your open visit. Thoroughly review your documentation. If you're satisfied, click End Visit to clock out. The nursing form will appear. Again, if it's accurate, click Confirm and Sign. Sign your name clearly and legibly. The Click Here to Sign button is for the parent family signature. They can also review the information, click Next, and then they sign. Lastly, you will click the green Submit Visit, and you're done. You've done it. Troubleshooting. With each Chromebook, you should have also been given a Chromebook cheat sheet for troubleshooting. Please refer to this for any questions. Video to think about the following. What will you do if you've tried everything presented in this guided video but are still having trouble with electronic charting? Call the 24-hour service desk if you've tried everything in this guided video and still need help. 844-696-2946. Take a breath. Give yourself a pat on the back. You are learning a new skill and it takes time. You've got this.